Digitalization is changing the entire healthcare landscape, and to know more, we are in conversation with Mr. Vishnu Saxena, who's the founder of DHN. Thank you for joining in.
Thank you, Sonia.
Pleasure to have you with us.
My pleasure. Thanks for having me.
First and foremost, we would like to appreciate that you've come back from US to serve the country. So talk to us about the platform and its uniqueness.
Yeah, and this was very personal to me. I mean, I've been working in the US healthcare for a long time, and I learned a lot. I worked with variety of healthcare organizations, solved variety of problems, made career there, created a name, and it happened so that I wasn't able to come to India, and then I came to India after a long time. And so last year when I came to India, it was like after 12 or 13 years. And India has changed a lot. The India that I left and the India which I saw last year was completely different. I mean, of course, there are lots of things that are still the same, but when it comes to, digital, when it comes to, the experience of technology and walks of life and all those things, infrastructure, and India was changed, and I was speaking at a conference called THIT in Delhi, and my topic was data democratization, accelerating India's digital health transformation. And I got an opportunity, and that was my first conference I spoke in India. When it comes to healthcare.
Sure.
In US, of course, I go to variety of conferences. I speak, I moderate, and whatnot. But that was my first experience with an India-based premier healthcare conference. And I wanted to know in terms of what's happening on the ground, what health systems, what hospitals are doing, what kind of conversation is happening, what government is doing on its part to essentially unlock the potential of digital in India. And I'm talking about the NHA. So I got to know the kind of great work that NHA is doing. NHA, in fact, I would say, is kind of like a real catalyst in terms of bringing the data revolution, because the healthcare is now very digital. What does digital mean? Digital data.
Absolutely.
Right? So healthcare is very data driven now. Healthcare always has been. Remember when we do the thermometer, when we take the temperature, what it is? It's a data, right?
Yes, absolutely.
So healthcare is very data driven, always been. Now we are trying to leverage that data in a manner which is not confined to a one hospital. So, for example, if you go to Chennai, or if you go to Delhi, or if you go to any other place, and unfortunately, if something happens and you go to the local doctor there, you can carry that data. I mean, so that hospital will have your data, so they can provide you better care. So I learned about all these things which India is going through, and I realized that this is exciting. And while going back, and I was thinking all the things that I learned, I saw the startups, and I met with a variety of top leaders from hospital, discussions that happened in that conference. And then I was thinking, India, what I can bring back to my country.
Wonderful. Right. That's beautiful.
Yeah, and I wanted to serve. I'm a son and a grandson of physician myself. My grandfather and my father, they practiced medicine in the most basic setting. We talked lots of technology, we talked lots of things around like patient engagement, leveraging technology, better experience, better engagement, better access to, provide better access, of healthcare. But, when I think about them, when I was, like in a home and all those things, I saw my grandfather practicing medicine in a very basic setting, very pure relationship between patient and the doctor, very trusted, and same experience with my father and my father's patients. So I grew up with that. And I never thought that I will go into the healthcare. I'm a BE computer science by profession, and I worked in IT industry for around 23 years. And when I went to US, somehow I got into healthcare. I started a healthcare practice where I was working in my job in my the company where I was working. Then I grew up and did well in the healthcare space in the US, and that's why fast forward coming back. Then I was thinking what I want to start. I don't want to create a healthcare software and throw it to hospital that, hey, this is another software, hey, please go and use it, and this will do X, Y, Z. No. I wanted to create a platform, an ecosystem that can bring together all the parties, all the ecosystem, all the stakeholders, across the value chain. And I was thinking for that answer, what that platform could be.
Right.
An idea of a dedicated digital health platform was born. And in fact, DHN was not the first name.
Okay.
Digital Health News not.
What was original?
I can't share that. But that was something else.
Sure.
So that was something else.
Sure.
And then the DHN came in, and then we created the portal, the platform. We hired the team, we hired the editor in chief, we hired the industry analyst, we hired the technology team. We launched the portal, Digital Health News, last year in October at Leela Palace in Delhi. And then the idea of the DHN, Digital Health News, is not about the news. It's much beyond news. Of course, it's all about the insights that matter, but that's the DHN's core.
Sure.
But we wanted to, be the catalyst that is set to transform the digital healthcare in India.
Right. Wonderful.
And then, I was thinking about it. What could be those avenues? What could be those channels, which are DHN led?
Right.
So DHN Forum was born.
Okay.
So DHN Forum, the idea of the DHN Forum was, as I mentioned,